Well, happy Tuesday and welcome to VA Careers Live. My name is Mike Owens and I'm a national recruiter with the Veterans Health Administration, as well as your host for our weekly segment, Talk About It Tuesday. If you're tuning in for the first time, I just want to let you know that we are here every Tuesday at noon Eastern Time. So feel free to grab a drink, grab a snack, and join us as we talk about careers here at VA. Now, whether you're tuning in for the first time today or you've been with us for the last 3 years, you know that we want you to be part of the conversation. So feel free to leave any questions and comments in the comment section below. Our team and I will go through those questions throughout the day and throughout the week to make sure that all of your questions are answered and all of your comments are addressed. And also, we all know someone who wants to work at VA. Even as a VA employee myself, I know people that want to come work for VA. You all that are viewers, whether you're employees watching or your candidates that are trying to get into the VA, we all know others that want to get into the VA. So we ask politely that you please share our broadcast. Again, hit that share button. We have a couple of hashtags that we use for this broadcast. The first hashtag is work at VA. Again, the first hashtag is work at VA. And then our second hashtag is VA career. So again, hit that share button, plug those two hashtags in there, and let's get this information out to as many as people as possible because we all want to make sure that we're helpful to anyone that's either looking to move around in the VA in case you're already a VA employee, or to those who are not a VA employees and you want to come on and hop over on board. We want to make sure that we get this information out, not just to you, but to others that are in your same predicament. So again, as always, it's Tuesday. Thank you for watching. I appreciate everyone that tunes in on every Tuesday. And also I appreciate those who are able to pop in periodically. And for those who are popping in for the first time today, I appreciate you. And I hope that you stick around with us. As always, I like to always start off with a question of the day. So as some of you may know, I know some people may partake, some people may not, but I was watching the news this morning and I saw that the Powerball had jumped up to $1 billion. And I think that if you win the $1 billion and you take the cash payout, I think it's about $560 million. So my question for you today is, what's the first thing you would do, or what would you do if you woke up tomorrow morning and you had $500 million in your bank account? So again, kind of a fun question. I know it's not really dealing with VA careers, but again, it's kind of that icebreaker question to kind of get you guys into the broadcast. So so a question of the day is, again, I was watching the news this morning and I saw that the Powerball had jumped up to 1 billion. That's billion with a B, $1 billion. And so the cash payout is about 500 million. So what would you do if you woke up tomorrow morning and you saw that you had $500 million in your bank account? So go ahead and put that answer below. I really don't know what I'll do. I think I'll be more in shock than anything. Like, to just wake up with that much money, it's just like, okay, I don't know what I would do after the shock wears off, but I know I'll definitely wake up in shock. But I'm excited to hear about those answers, and I can't wait. So today's broadcast, I know you guys are ready for this information. We put out a poll a few weeks ago, and we asked the audience, we asked you guys, like, what are some topics that you would like us to talk about? And so we got all you guys' answers, and I want to say thank you to everyone who participated in that poll, because again, we want to make sure that we're giving you the information that you want and what you need. We don't want to get up here and give you information that you're not necessarily looking for. So we wanted to ask that poll, and we wanted to see, okay, what are things that our audience members, or you guys that are viewers, what do you want to what do you would like us to talk about? So I think we kind of went through all of the percentages, and I think that our top percentage at 58% was people wanted to hear about administrative positions here at VA. I know we talk about, when people think about the Veterans Health Administration, they think about doctors, nurses, those folks that provide immediate patient care, and the VA is bigger than that. Although our main goal now, yes, our main goal is to make sure that our patients, which are our nation's veterans, are taken care of in the most awesome manner imaginable. But there's a lot of people that makes that happen. I know a lot of times we may think that the providers, again, those that give direct patient care, those are the heroes. But there are a lot of heroes in VA. I remember back during the pandemic when one of the highest tasks, one of the highest priorities was keeping the medical facilities clean and sterile. And some of those local heroes at the VA medical centers were those housekeeping agents that kept those facilities spick and span, so that when our employees and patients and veterans came in, they had a nice, clean, and sterile environment to work in the middle of a pandemic. So anybody, no matter what position you sit in here at the VA, you can be a hero. And so what we're going to do, we're going to talk about again, the top topic in the poll that we had was the administrative job. So again, there's a lot of administrative jobs, but I'm just going to talk about maybe a handful today. And I'll go from those administrative jobs that are kind of entry level, and I'll work up to those that are, that are more complex, and those that may require a little bit more experience. All right. So again, today we're talking about some of the top administrative positions here at VA. So the first one I want to talk about is the title Program Support Assistant. Again, it's Program Support Assistant. If you're interested in working in an administrative role here at VA, I would recommend that you get a piece of paper, and I recommend that you write these job titles down because you can go to USA Jobs or VAcareers.gov, .va.gov, and you can go and search these job titles, and maybe you'll find the perfect job that you're looking for. So the first administrative role that we're going to talk about today is the Program Support Assistant. So the Program Support Assistant is kind of the jack of all trades in the clerical role for departments within VA facilities. And when I say VA facilities, I'm talking about your medical centers and some of your major program offices. So if you go into a VA medical center, there's different departments. You may have your housekeeping department. You may have your engineering department. You may have your there's a lot of different departments that are in hospitals, and each department has a chief, and sometimes they have a deputy chief. So obviously your chief is the person that runs that department. So if I'm the chief of finance, if I'm in the finance department, I'm the chief of finance. Obviously, I run the finance department. Under the chief is normally an assistant chief, and so that assistant chief, has duties that are divvied down from the chief, and then normally under there's a lot of other different roles, but you have a program support assistant. So basically what the program support assistant does, it's one of those entry-level clerical positions. Like, you can organize staff meetings within that department. You can collect data. If the chief has to give a presentation, or someone in the department has to give a presentation, you're in there, you're preparing those presentations. If there are meetings that are going on, you may be putting together agendas. You may be the one that's in charge of copying or writing the minutes for meetings. You're scheduling meetings. You're maintaining calendar invitations, because those chiefs of those departments, they have a lot of meetings. They go to a lot of different meetings. They're talking to a lot of different people. They have a lot of different appointments with people around the facility. So one of your main roles is making sure that you are maintaining the chief's calendar. You're making sure that you're sending out calendar invites in case that chief has a meeting that they want to host. And then you're coordinating communications between the departments. So you're like the radar. And if some of you that are older out there, you remember the TV show MASH. You remember radar was just the one that everyone communicated. He had all the information. He made sure that the place just ran flawlessly. And so, as a program support assistant for a department within a VA medical center, you're basically keeping that ship afloat. Again, you're making sure that the chief knows what's going on. The chief knows where they need to be. Same thing with the assistant chief and anyone that works in that department that you're working in. So program support assistant, if you're interested in that, if you feel like this is something that you want to do, go ahead to USA Jobs or VA Careers and put in the search for program support assistant, and maybe there's a job out there for you. So again, if you're just tuning in, we're talking about some of the top administrative positions here at VA. Again, there are a lot more administrative positions that we're going to talk about today, but obviously I only have 20 to 25 minutes, so I can't go over all of them. So the first one we went over was program support assistant. The next one we're going to go over is secretary. And I know you're probably saying, well, isn't a program support assistant the same as a secretary? In some departments, they're used interchangeably, but in others, you may have a secretary and a program support assistant. So a secretary, again, a lot of, I guess I mentioned, you have chiefs, you have your medical center directors, you have your PENTAD. Your PENTAD is the group of people that run the medical center. You have your, if I know here in New Orleans, there's the medical center director, you have the deputy director, you have an associate director, you have an associate director of patient care services, which is your chief nurse, and then you have the chief of staff, which is a MD that runs a lot of your medical, that runs a lot of the actual medical side of the facility. So in New Orleans, there's 5 people that run the hospital. And for the most part, when you have someone that's high, or you have someone that runs a national program office within VA, that person, that supervisor, or that chief that's over that medical center, or the associate directors that's over those medical centers, or you may have some directors or chief or assistant directors that over the national program offices. A lot of your folks that work at VA central office in DC, or the various VA regional offices across the country, those top managers may have a personal secretary that works just for them. And the function is kind of the same as a program support assistant, but I would say the biggest difference is that the program support assistant is mostly they're mostly supporting the whole office, the whole department. So if I'm the program support assistant over finance, I'm supporting the whole office. Now, with the secretary may just be supporting that one person. So if I'm the secretary for the medical center director, although I'm working for the medical center director, but although I may do things that will help others in that office, my main position as a secretary for the medical center director is to support that medical center director. It's basically, I would be responsible for the clerical and administrative functions of that medical center director. You know, I'm organizing that medical center director staff meetings. You know, I'm collecting data. You know, medical center directors, they get a lot of data. They get a lot of things thrown at them. They have to approve a lot of things. And so that secretary is there to make sure that they organize all the things that are flowing into the medical center director's office. I'm preparing presentations. We know that medical center directors give presentations within the medical facility and within the community. So that secretary is making sure that everything, all the I's are dotted and all the T's are crossed with those presentations. You know, they're putting together agendas for the medical center director. They're collecting minutes of meetings. They're scheduling meetings, maintaining the calendar. They're answering phone calls. Sometimes they may be linked to the medical center director's email system. So what they're doing is that they're going through emails, answering the emails that they can themselves. And if there's something important that the medical center director needs to handle his or herself, then that'll be forwarded over to the medical center director. You're the point of contact for everything that has to do with the medical center director. And I'm just using the medical center director position as an example. There's a lot of other positions within VA that have secretaries, but basically as a secretary, you are there to support that one person that you are the secretary of. Again, as I mentioned in the first position, the program support assistant, it's program support. So you're basically supporting the whole program or the whole office or the whole department. But as a secretary, a lot of times you're tasked out to one person, and you're basically that one person's assistant. So again, if you think that you are interested in the secretary position, that's something that you would like to do, or something that you may be interested in, whether it's something you've done before or something you just want to get your feet wet and try. Again, go to our VA Careers website, type in the search engine, the job search engine secretary, and guess what? You'll see some positions pop up. All right. So the next one I want to kind of tap into is the medical support assistant. So again, if you're just tuning in, we're talking about some of the top administrative job positions here at VA. We first talked about program support assistant, then we went into the secretary position. So now we're going into the medical support assistant. So now the medical support assistant, this role has to deal with more of dealing with patients. So now you may not, again, you're not a provider, so you're not dealing patient care, but you're doing various things to help the veterans that are coming to receive their care at the VA. So as a medical support system, or MSA, as some people may call them, you know, some of your duties are scheduling, canceling, and rescheduling appointments. You're directly dealing with patients to make sure that they know when their appointments are, they know where their appointments are, what time their appointments are, or if someone calls and say, hey, I need to cancel or reschedule the appointment, you're that point of contact for that patient, or that veteran rather, to be able to reschedule those appointments. All right. If a veteran is a no-show, you're there to input that information. All right. You're monitoring appointment requests. So if a veteran calls in and says, hey, I have a specific request, or I may need a wheelchair when I come to the medical facility, or I may need this, I may need that, you monitor those needs. So when that veteran comes for their appointment, guess what? You're right on it, and you're making sure that those requests are you're making sure those requests are being granted. Again, you're dealing with all type of appointments. You may be dealing with inpatient appointments, which is for those veterans that are coming in and they're going to come to appointment or have a procedure and they're out at that same day. Or you can be dealing with inpatient. I may say inpatient, I'm sorry. For outpatient, you may be dealing with veterans who are coming in and leaving the same day. But for inpatient, you may be helping veterans and dealing with veterans that are helping them with their appointments, or for any type of procedures that may keep them at the facility for a couple of days. All right. You're participating in helping other medical support assistants, because that's a very important job, because as a medical support assistant, again, you are the front lines for the veterans before they see the provider. You're making sure, again, those appointments are not only scheduled, you're making sure that the veteran knows when their appointment is. You're making sure that they know exactly what clinic. Are they coming to the main hospital, or are they going to one of the clinics that are in the surrounding areas? Is their appointment being outsourced? You're the main person to make sure that that veteran knows exactly where they need to be, when they need to be there, and why they need to be there. So again, if you think you're interested in becoming a medical support assistant because you've either done that role, or you're going to be or you want to, again, get your feet wet, go ahead to VA Careers, our VA Careers website, and guess what? Go put medical support assistant inside of the search engine, and you'll find a lot of MSA positions that are available. All right. So the next one I want to go to, and this is kind of the last one that I want to talk about today, and this is more of a higher level administrative position. If you have a pen or a piece of paper, it's called a health, HEALTH, system specialist. Again, health system specialist. And what a health system specialist is, they have multi roles. They're that one person that's just kind of, I know I talked earlier about the program support assistant, but this person is this health system specialist. They're the point of contact for multiple departments within the medical center. I know when I talked about the program support assistant position earlier, I was talking about you're the glue that keeps that one department together. But when you're a health system specialist, you're the glue that keeps a lot of different departments together. And in the VA world here, or especially at the medical center level, one of the top roles of a health system specialist is to be the executive assistant for the leaders within that hospital, or the leaders within that national program office. So as I mentioned earlier in the broadcast, that here in New Orleans, at the New Orleans VA, there are 5 people that are part of running the hospital. You have the medical center director, you have the deputy director, you have the associate director, you have the associate director of patient care services, which is your chief nurse, and you have your chief of staff. Obviously, your chief of staff is a medical doctor, a physician who runs the medical side of the facility. But each of those 5 people have an executive assistant that is assigned to them. And of course, being a leader in a medical facility, you are over a certain amount of departments. Like I said, the chief of staff has their departments that they're over. The associate director of patient care services has the departments that they're over, and so far and so forth. So a lot of information are coming at them. They're in a lot of meetings, a lot of people requesting things out of them, and so they have to have that one person that's kind of just catching all of those requests and making sure that they prioritize them. If they can deal with the request without it going to the main person, then they try to deal it with themselves. So if you're one of those persons who ever been an executive assistant to someone in a high level position, this would be perfect for you. And the one good thing about being a health system specialist, it's a lot of times it's a stepping stone for you to become a leader within VA. I've known some health system specialists that have served as executive assistants to leaders within VA, and then themselves then moved into a role of an associate director of a medical facility. So if you're looking to become a leader within VA, if you're looking to be in the main office, dealing with all of the stuff that the leaders deal with at VA, whether it's as an executive assistant or one day you're looking to be a leader within the VA, whether it's a leader at one of the medical facilities or whether it's a leader within the National Program Office, the health system specialist is a role. And I know that there are some of you that are watching that served in the military, and you may have been, for flag officers, whether you were in the Coast Guard or the Navy, they were admirals. But if you're in the other services, generals, every general has an aide-de-camp. That's basically the executive assistant role on the military side. If you ever served as an aide to a general or aide to an admiral, guess what? That's what a health system specialist is within VA. And if you've ever served in that role, guess what? This is the perfect role for you. And a lot of times, again, I've seen people that served as aides to generals move in, and eventually somewhere in their career, they became a general admiral themselves. So if you're willing to come to the VA and you want to get the inner workings of the upper echelons of VA, whether it's the upper echelons of working at a VA medical center or the upper echelons of working at VA central office or one of the national program offices, and you have that experience, especially if you served as an aide to a general or an admiral, health system specialist is the perfect position for you. So again, those are just a handful of some of the positions that we those are just a handful of some of the positions that we had. And and so if again, that's just a handful of the positions that we had. There's a lot of other positions here, but if you're interested, again, if you wrote down some of those positions, just go ahead and go to VA Careers website, go in the search engine and search those positions. But again, if you were watching, we were just talking about some of the top, if you're just tuning in later, we were talking about some of the top positions, some of the top administrative positions within VA. Again, this broadcast will be continuous on our many social media platforms. So again, feel free to go back and watch. So I do think that I have one question that's been posed out here, and it's about the medical support assistant position that I mentioned earlier. So this person is asking, I think the name is Natalia. I think it is. I think Natalia is the name. Natalia is asking, first of all, thank you for submitting that question. Natalia is asking, is the medical support assistant an in-person or a hybrid position? So I will say this, most medical support assistant positions are not hybrid or remote. They're in person. You're actually working inside the medical facility. So if you are a medical support assistant working working for the VA hospital in Los Angeles, California, you're most likely going to be reporting to that facility every day. So there are not many, or if any, I won't say there aren't any, but there are probably not many medical support assistant positions that are hybrid or virtual. And if I'm mistaken on that, I'll make sure I'll come back and correct that. But if you are a medical support assistant within the Veterans Health Administration, there's a great chance that you're working at that facility full time. And is it assigned to medical support assistant? Is it assigned to a specific medical department? So, yeah, it's most of the time these medical support assistants are assigned to inpatient and outpatient clinics because, again, you're making sure that our veterans who are our patients are, you're making sure that you're setting up their appointments. You're making sure that you're basically dealing with our veterans. You're helping our veterans before they get to their appointment, when they get there, and when they leave. So you're not giving them direct patient care, obviously, but you're making sure that they get to their appointments. You're making sure once they get there, they know where to go. They have everything that they need before they see the provider. Once they finish with the provider, they come see you again, and you're scheduling follow-up appointments and making sure that they have everything that they need before they leave. And yeah, and then you're talking to them, making sure that they understand and make sure that they get any type of correspondence that has to do with their appointments. So Natalie, I hope I was able to answer your question. And again, I want to thank everybody for joining in today. As always, if it's Tuesday, we're definitely going to talk about it. And again, our question of the day was, if you're just tuning in, is we talked about how the Powerball has hit $1 billion as of this morning. I saw it on the news. And the payout, if you decide you want the lump sum, the payout is $568 million. And so the question that we had is, what would you do if you woke up one morning and had $500 million in your bank account? And I would love to hear those answers. So with that, I want to say thank you for watching. We appreciate you watching, whether you're watching for the first time today, whether you pop in periodically throughout the weeks, or whether you've been watching us every week for the last 3 years. We appreciate you. Let's get this information out to as many people as possible. Hit the share button, and we'll talk to you on next week. Have a great day.